There are types of COVID. I will explain them easily because if I explain them as in a medical journal, believe me it is more difficult. COVID patients without symptoms are those people who look normal, but maybe they lost their taste for the taste, or they don't smell and only that is what they have. Others with minimal symptoms of COVID may feel with a super flu, cut body tiredness, headache, but if they measure the oxygen with a saturator or oximeter, this is normal 96%, 99%. They do not need any treatment. Their body will heal them only vitamin D. Rest at home and paracetamol in a period of 15 days. Obviously eat well, take liquids and omega-3s and things like that. Great snacks become the serious COVID. For the doctors they are serious because they started with an irritating dry cough that suffocates them, that their saturation dropped below 90, and they have a high fever higher than 38 degrees and they feel short of breath. And here it is important to know that there are two types of patients. Those who have no disease other than COVID, and those who apart from becoming infected with COVID have more diseases such as diabetes, hypertension and obesity. Primero's first ones have from a 60% perhaps an 80% chance of going out alone. Is a matter of good initial medical treatment in the first days, because the prognosis at the time of diagnosis depends a lot on it to decide to start some extra treatment, or if you need antibiotic and anti-inflammatory, good nutrition, good vigilance, and voila, it will be almost a month's agony, but your body will come out little by little. Second that are our anxiety and concern, our important hospitalization to which we must take care of pressure levels, sugar levels, if they have heart damage, if apart from the COVID they already had lung damage, if they were bricklayers, carpenters, if they have HIV. Seeing COVID is not a kitchen recipe as the vast majority think that everyone is being given the same treatment and not everyone is cured. Why? Well, why are there more things to attend to and take care of? The problem is that with so much misinformation everything is chaos. In previous writings I told them to read from medical journals. If the treatment is not in a renowned medical journal, it is pure valueless assumption. For example, if you're looking for something that you want to read, for example, with a diabetes expert, the most important person in diabetes studies is called Franzo. If you look for it on the internet, many articles with that surname will appear, and it is because your work is recognized internationally. Many years and because all those who do research in the same branch approve it. If you want to read about mechanical ventilation, you look for writings by an expert Italian Gagione or by Paolo Pelosi, who are practically the ones who write the most about ventilation, and in Mexico some doctors from Querétaro. They are already doing their first steps with level publications, and believe me the medical articles will appear. In Mexico we have the gastroenterologist Higuera de la Tierra. She writes a lot about gastro or cryoing intensive care, and so one is writing medical articles from people who really read, study and research and are recognized internationally in medical journals such as JAMA, NAJM, Lancet, Nature, the Mexican Gazette of Internal Medicine, etc. And well, therefore I believe that you should trust the results of the treatment you are dealing with, but I really feel terrible that many continue to believe in miraculous things that perhaps they do not need, and what they do not need or use. For example, their insulin for diabetes. Well, changing the subject, I have a patient that our family is hard and give her the test to see if they have COVID. I had already told you that although the test turns out negative if you have fever, cough, they saturate 86% with tachycardia with high DHL, because it is obviously COVID and it will be treated that way even if the test is negative, because the clinical picture always rules. And if your test comes back positive and you have no symptoms or feel anything unusual, what you have is an asymptomatic disease, and the only thing you should do is stay home because you're infecting us. Just take the recommendations and eat well and take care of yourself.